dementia, or even Alzheimer's. But your brain is much more likely to be at risk of harm from more common conditions, diabetes, vascular disorders, and infections. We talk about protecting your brain with neurosurgeon Dr. Philip Stieg. He's founder of the Weill Cornell Medicine Brain and Spine Center. As an aside, he's the guy who checks out New York Giants players for concussions on the sideline. He says your brain will benefit from a lot of good food.
You want to avoid a high carbohydrate diet. You want to avoid a high sugar diet, and you don't want to do things that cause inflammation. So you want to reduce stress in your life. Chronic stress can lead to damage to the brain. I will give you a good shopping list if you would like that.
Please.
So you want to eat salmon and fatty fish, so herring and tuna. You want healthy fats. You don't want trans fats. So you want olive oil, organic butter, avocados, coconut oil. You want to eat a lot of nuts, seeds, free-range eggs. You can drink coffee or tea, turmeric, blueberries or dark fruits, raspberries, a little cocoa, dark chocolate, 2 cubes on a daily basis is good. Fruits and vegetables are good. Overall, it reduces mortality by 8%. It can reduce the risk of mild cognitive injury or Alzheimer's disease by up to 40% in certain studies.
Doctor, if I can put in a plug for our website, WTOP.com. Of course, we have all the news for the Washington area and national and international, but we just added a games section. So there's Sudoku and some other things like that. Do games help you keep your brain active, or should you do something else? Should you read? Should you stimulate your brain in another way?
There are certain companies that have been doing a lot of advertisements that are now under litigation. I don't want to go into that. Learning mnemonic skills is good for you. We know that cognitive behavioral therapy has been beneficial for patients with dementing processes, and certainly social interactions, staying engaged in social activities is excellent for you. Isolation is not good. Mental stimulation is important. Keeping the brain active with reading, with music, and social interaction is very important. As I said earlier, stress reduction is very important. Getting 7 hours of sleep a night is very effective for you. There's some thought that while you're sleeping, your cerebral spinal fluid moves more fluidly and it washes out the toxins of the central nervous system. Mindfulness training, meditation is also good. There are now MRI studies that show that it increases the thickness of the cortical layer of your brain. It preserves the hippocampal region of the brain, and it increases the connectivity between the two hemispheres, as demonstrated by increasing white matter. So all of those behaviors are very important. Again, I can't emphasize 30 minutes of exercise a day enough. It reduces stress. It increases our sensitivity to insulin. And from a cognitive standpoint, it helps you improve on your executive function. And by that, I mean organizational skills, thinking abstractly, and the one thing that humans can do above all other primates is plan for the future. So all of those activities are also beneficial.
That's Philip Stieg. He's a neurosurgeon joining us on Skype with tips on keeping your brain healthy and sharp, largely through diet and exercise. He doesn't seem to be against Sudoku and crossword puzzles, but he also doesn't seem to believe that's the main key to keeping your brain sharp.